Hello, I'm Deborah Chieli, a nationally board certified nurse practitioner with specialty certification in lifestyle medicine.
And I'm Susie Spill, a nationally board certified nurse practitioner, also certified in lifestyle medicine.
The following interview was part of a series that informed our presentation at the 2023 Annual Conference of the American College of Lifestyle Medicine, ACLM, titled Nurses in Action, How Nurses Operationalize Lifestyle Medicine in Modern Settings, and You Can Too.
In this series, nurses from diverse backgrounds and practice settings and their champions tell their personal and professional stories about discovering lifestyle medicine and how they're implementing it across a wide range of settings.
Nurses are the largest health profession in the United States and globally, and have been voted the most trusted profession here in the U.S. for over 20 years. Learning about and incorporating the pillars of lifestyle medicine fosters full scope of practice and the ability to answer the call to lead by the National Academy of Medicine with their report, Future of Nursing 2020 to 2030, Charting a Path to Achieve Health Equity.
We hope these stories of success will inspire conversation and drive creative solutions to better address inequities in healthcare. Continued growth of nursing expertise in lifestyle medicine will expedite our nation's ability to address the public health emergency of chronic lifestyle diseases we currently face.
The power of nurses to create innovative solutions when combined with the practice of lifestyle medicine allows nurses to express their full potential while simultaneously addressing the salient issues of health equity, the epidemic of chronic disease, and the provision of truly patient-centered whole-person care.
When nurses are empowered to lead with an interdisciplinary and multi-sector practice, they answer the call of the National Academy of Medicine to dissolve barriers to care and improve health for themselves, the nation, and every global citizen. Enjoy the interview. Today's guest is Nan Robinson, a baccalaureate-prepared nurse and diplomat of the American College of Lifestyle Medicine who is passionate about bringing lifestyle medicine into practice. She is a complex care manager, CCM, and she works as a care manager for the lifestyle medicine team at Trinity Health IHA Medical Group in Southeast Michigan. The lifestyle medicine team there has 7 lifestyle medicine board certified providers and is headed by physician leader Bob Brakey. Nan, thank you so much for sharing this time and all of your wisdom. I am really excited to talk to you, and I know a lot of nurses will benefit from what you have to say today. So thank you so much.
Thanks for having me.
You're welcome. So I want to start off with a little bit about your overall role, what you're doing now, and also how you even discovered lifestyle medicine to begin with. I think of it like your origin story in finding lifestyle medicine. Will you tell us about that?
Sure, absolutely. So I stumbled upon lifestyle medicine. I was a nurse manager and actually went to one of our quadruple aim meetings held at IHA, headed by Bob Brakey. And years ago, maybe 2019 or so, he had a cardiologist from Boston speak. And that cardiologist talked about lifestyle medicine. And it was kind of the first time I had heard about that whole concept. And from then, I was kind of hooked and did more research and read a few books and talked to Dr. Brakey. And so that is kind of what triggered my interest and my passion for this. So currently I am a lifestyle medicine care manager, the only one for our team of 7 providers. And we're across Southeast Michigan, as you said, in 4 different offices of many of Trinity Health primary care setting. So my role is actually supporting patients with monthly touches to support their behavior changes. I meet with patients virtually and in person and on the phone and talk to them about their lifestyle changes. I have a patient panel of about 100 patients at any given point in time of enrolled patients who are working towards their lifestyle changes. And I get those patients really in 3 different ways. Either those patients have come to me following a consult, a 1-hour consult with one of our 7 lifestyle medicine physicians, or they've attended one of our shared medical appointments, or they've gone to Rochester, New York's Jumpstart program. We are partnered with them and send many patients to the Jumpstart program to learn a little bit more about the plant-based diet and kind of indoctrinate themselves into that. It's a wonderful program. So at this point in time, after 2 years of being launched, the Lifestyle Medicine Group here at IHA Trinity Health, we have had about 250 patients go through our program. So my role is to support them, call them monthly, meet with them at our group meetings, and really work with them, use all my motivational interviewing skills to listen to them, learn kind of where they are in their journey, and help them set SMART goals. And we've all heard of SMART goals, those really pinpointed, realistic, achievable goals that they could do over the course of the next couple of weeks to a month to achieve their goals. So I provide education, give them resources, again, kind of tapping in on a real personal level of where they are and what they need and what they seek as far as information and education. And I use our data bank of resources to send them things via the patient portal called My Chart, or sometimes snail mail. And so that is what I do on a daily basis. I also support the team. We're very oriented in team-based care here at Trinity Health. So as part of the team, we work very much together in providing these shared medical appointments. I'm the facilitator along with one of the providers who's ever hosting that month, and they each host one about once a month, and help support that setting as well, and stay in close contact with the providers.
Nice. That sounds amazing. If I would have known about something like that, I would have loved it. So I want to go in a couple of directions. So first I want to talk about you as a nurse, and then I want to talk about, the practice and the patients. So you are a complex care manager and you're certified in lifestyle medicine. So I'm guessing this combination of knowledge and skills has allowed you to serve in the role that you're in, right? And in addition to that, was your role as you are serving it right now, did that exist before you got the position, or was that a new position for you or for the team? How did it evolve?
That's an interesting story because the Lifestyle Medicine Group at IHA was launched in the summer of 2021, and we've been building and growing it since then. So initially, it was 4 providers as part of that with a project manager, and they were kind of getting all the pieces in place. At that time, I was a nurse manager looking over the care managers at IHA, and care managers in the historic setting work in the primary care offices and work in several different ways with complex patients. One of the biggest populations they have is hospital discharge patients. And how do we get to that patient and prevent rehospitalization? What are their barriers? Where are their needs? And they also work with very complex patients who have not been to the hospital to see if they can get them to a place of better health and really improve their health, to decrease their medical costs, improve their overall health and satisfaction. So that's the role of a care manager. And anyway, when I heard and kind of got involved or more educated about lifestyle medicine, I really wanted to work for that group, for Dr. Brakey and his counterparts. There was no role. So I kept using all the different angles I could to say, hey, you know what you're missing on the team is a nurse. You need a nurse. So, and pretty quickly they listened and were like, you know what? Yeah, we do. That is missing from our group. So I was able to kind of create that role, if you will. So that's, hopefully that answers your question. Yes, I kind of created it.
Yes, it does. And the theme that I keep hearing when we're talking to nurses is just that, like, pushing the envelope a little bit. You have that passion and you're like, you see the need and you can fill it. So, you talk to the right people, get in communication, have partnerships, and just say, hey, this is what I can do for you. If maybe they didn't know that beforehand, right? What I'd like to know, do you feel like it almost seems like, okay, you said a few things that I want to touch on. Population, I almost think of it like population management. I used to work in a place, I'll give you an example, that had RNs that would help manage populations that had a certain diagnosis. like asthma or sickle cell or certain allergies, and they would have that whole group of patients that they would help manage. And in my mind, what you're talking about with complex care management is probably what they were doing with a certain subset of patients. And do you feel like that's what you're doing now with lifestyle medicine? I'm guessing as the people come to you, they have some kind of chronic medical condition that they're wanting to make better? Or is it more preventative? What would you say?
Absolutely. You're spot on right with the chronic illnesses. And you're exactly right with the care manager role. It was in and of itself was working with complex patients with chronic illness of many different kinds. Correct. So in lifestyle medicine, we can absolutely see and sometimes do see patients who really are there just to prevent future illnesses and disease processes. Primarily, however, our population is patients with cardiovascular disease, hypertension, type 2 diabetes, and obesity. That is the main components of the patients we see. Many of them, unfortunately, have several of those diseases ongoing. So, yeah, that is who we target.
It sounds like you're using a coach approach with a lot of this in the way that you're setting goals and that kind of thing. So I want to know a couple things. Did you have some training? I mean, lifestyle medicine does give us some training in the coach approach. That's really nice because I think that's a piece that's really needed. And then the other piece, and I do want you to touch on specifically the diet piece, because I think there is confusion among RNs or teams in healthcare about what an RN can and can't say. A lot of times we defer to somebody else, maybe a dietitian, maybe a physician, to talk about diet. I'm guessing that your training and the specific knowledge you have allows you to be able to educate in that way. But could you comment a little bit about like scope of practice, I guess is what I'm really trying to ask.
Sure, right. And that is such a good question because that's always the hesitation point for we nurses. So first of all, as a care manager nurse trained within the state of Michigan, we have coaching and much education on motivational interviewing and the skills of talking with patients and really eliciting that change talk and really working through that behavior change. It's all about, no matter what condition it is, to get patients to a place of better health. It's about behavior change. And so what does it take to change that behavior? Hardest thing in the world is to change a behavior, to change a habit. So we're trained in that skill of motivational interviewing and frequently using those skills to elicit that change talk and then identify it and go with it. So that is the training I've had. And the certification to become diplomat for the ACLM, there was also some of that education as well, kind of reinforcing that. But to speak specifically to the nutritional component, which is always the big headliner, right? We have 6 fabulous pillars of lifestyle medicine. And frequently I say to patients, you could have the best diet in the world and the best exercise program. You could run a 5K every morning, but we all know unless our stress is well managed in our life, our disease processes will still continue and possibly even get worse. That aside, it is typically the conversation revolves around what do I eat, the plant-based diet, how do I turn for help? So on one end, we do have, as part of our team, a lifestyle medicine prepared nutritionist as part of our team. And we do sometimes frequently, I would say, refer to her. But in and of that self, patients that have not seen her, I am very comfortable and it is well within my scope of practice to talk about their diet. And just like any nurse, any well-rounded nurse calls a patient after a hospital discharge and talks about wound care and exercise and mobility, safety measures, so many different things, family support, financial resources, all these things. We nurses are the wraparound care, identifying any barrier to health. But why are we so uncomfortable talking about nutrition? Why are we so uncomfortable and feel like we need a degree in nutrition to say, decreasing processed foods would really be beneficial to help regulate your blood sugars. We know this. We don't need a nutritional degree. We are trained professional nurses. So many times I'm following kind of the guideline that the provider has set if they've had a one-on-one consult and the provider has kind of laid out, here's where you are and here's what I'd like you to change about your diet. I kind of dive into that a little bit more, taking the time and the energy it needs to say, is that realistic for you? And really honing in on that. But again, it's about education. Why are fruits and vegetables and whole grains and legumes so healthy for us? And so a lot of times it is just well within our scope, any nurse, to say, let's talk about your diet and what is realistic for you to maybe add to your diet. Let's not talking about taking anything away. You really love your barbecue ribs, and that is what you dream of eating every Saturday. Let's leave that on the table for a minute and let's talk about how many vegetables do you get in a day, and using real common sense metrics for that. Your hand is the best serving tool that you have. It's perfectly suited for your body. This is my serving size. So I frequently use, if you reached into a bowl of vegetables, how many handfuls would you grab in a day on average? From the chopped carrots to the sauteed onions and mushrooms that you put on the ribs. How many handfuls of vegetables would you say you have in a day? And just really bringing it down to a realistic level for them. But yeah, it absolutely, I stand on that pulpit, if you will, to say this is within our scope of nursing to talk about nutrition, identify where the areas of improvement could be, and identifying small changes to eliminate some of the things that are not great for them to eat. So, ACLM certified or not, I think that's absolutely within our scope of practice.
Right. I totally agree. And Florence Nightingale wrote about it many, many years ago. There's a couple things you've said that I want to touch on. And I've noticed you have said a couple of times that personal connection with somebody. So that's really important for people to feel seen and heard. And in doing so, you are also identifying, you called them barriers, or challenges people have. And I think that really gets to the point of our social determinants of health, which are really taking center stage now. There's been a call to action by the Future of Nursing reports, most recently the Future of Nursing 2020 to 2030, for nurses to act in a way to bring attention to the social determinants of health, like, do you have a car to get to the grocery store? Do you have a grocery store nearby? Can you afford groceries? Just who's cooking? All those different things that contribute to the social determinants of health. So I've heard you comment on the challenges, and I just wanted to point out that to me, it sounds like you're doing some of that. And I also wanted to ask, are you all using any kind of either metric or assessment when it comes to the social determinants of health? Especially that transition hospital to outpatient or very complex patients that you work with. Are you using anything specific?
Absolutely. So, yeah, that has been a big push since probably, gosh, I want to say 2019 or 2020 with our EMR system, Epic. We use Epic, as do many hospitals and different facilities in Southeast Michigan and across the United States. And built in that program is the SIOH, Social Influencers of Health. Same thing, different terminology, is the survey. And it's right on the left navigational home field, just right on we call it the dashboard, the patient dashboard. And it's quickly identifiable when you open up that patient chart, and it either lights up that it was done or it was not. Not only that, but it lights up in the areas that are red or yellow that the patient has expressed some need or concern, or, well, maybe my housing isn't so secure. So that lights up for all to see. It's really the team-based approach that every healthcare provider that touches that chart should be identifying that. If it's not done, do it, and addressing that at every touch point. So our team, our medical assistants, are, and we have metrics for this. We actually have percentiles that we're looking for as a whole. Are we getting at least 90% of the SIOH surveys done? As the care manager and part of that team, it is also our responsibility. And we do comprehensive assessments as part of any good nursing care, you're doing a comprehensive nursing assessment of that patient. And part of that is doing the SIOH survey if it hasn't been done, or addressing the highlights there if it has. So yeah. And then following that up, of course, with resources. We don't just identify them. How are we going to give resources? And that's done in many different ways. But yes, that's how we address that.
Thank you for that. And I haven't used Epic in a while. I used Epic for many, many years, but I'm not using it now in my clinical practice. But the field you talked about on the left, is that field always there, or do providers or anybody who's using Epic, do they have to put that field there, or it's always there?
Always there.
Okay, good.
Always there.
Okay. So I would like to talk about some reimbursement kind of issues, or how do, I know you're one nurse amongst a big team. I don't know a better way to say it, but like, how do you justify your role on the team? You clearly are bringing a lot of value, but the way that our structure is right now in our country, we're not capturing the work of nurses like I think we should, and reimbursement models aren't the way I would love them to be. So can you comment about that at all, the reimbursement structure?
Yeah, so that is always, any new program, anything like a lifestyle medicine program, it has to be viable. Unfortunately, we have to look at that financial piece of it, because if this is not viable for big medical organizations, it's not going to happen. It's just not going to happen. So, as a care manager nurse certified through the state of Michigan, we are able to bill for our phone calls. Now, having said that, most insurances do not pay for these calls. More and more are coming on board every year. I will say that. So, we now have a handful of insurances that will reimburse for our calls. And those are staged. We have several different billing codes we can use for a call, whether it's a face-to-face or we completed the comprehensive assessment. That's a different kind of bill we use. Whether we talked about the advanced care plan, we had a care team meeting with the team about that patient with a provider. That's billable. And then different levels of phone call based on time. So that's in general our billing codes, what they relate to. So the wonderful thing is there was a pilot done, I believe in 2020 with Blue Cross Blue Shield. Blue Cross selected 8 states in the US. And the question was, would it be worthy for them to pay for nurses in primary care settings to continue the work of the case managers at the hospital who push the patients out of the hospital, and they've ordered the hospital bed and the O2 and the home care nurse, but who's checking? Who makes sure that all that was delivered and how that patient is doing? So that was a pilot that lasted for 5 years. And I'm happy to report that at the end of 5 years, we dramatically improved rehospitalization rates. If you have a care manager, a specially trained nurse who has the time and the ability to wrap around care for that patient and make sure that everything is in place for a successful home stay after hospital stay. So it was very we proved ourselves worthy and wise that we can really improve healthcare for them, maybe more of a financial incentive because it would cost a lot of these as these patients continue to go back to the hospital and back to the hospital. So that is, I hope I'm answering that question appropriately, but that's, yes. So I do bill for my calls, and we have a fabulous billing department. Nothing ever drops to the patient. IHA, after that grant program was done, said, this never has felt right to us because nurses only could care manage Blue Cross patients at that time. And as soon as that was done, IHA came in and said, paid or not, we offer these wonderful care manager nurses to any patient in need. So most of our billings go by the wayside, and our billing department catches those. Nothing ever flows to the patient. So if there's a copay or something that potentially would drop to a patient, that is wiped away by our billing department. So care management services within Trinity Health are free to the patient, but we do get reimbursed by some insurances, now maybe a handful.
That's awesome. And so in your state, and I wonder if this varies from state to state, you have the certification as a CCM, but if you were an RN without that certification, could you still be billing for that work that you're doing in that kind of role?
You know what? That's a great question. And up until relatively recently, the answer to that would have been no. Now we have the state of Michigan has provided training for RNs because our wonderful triage staff is doing a lot of that work. They're also doing hospital follow-up calls, making sure there's no barriers to patients picking up those medications. They're providing lots of wonderful support. So they now have been, actually, we're in the process of training them through the state about goal setting, which they're already doing. I would defend. They're already doing this. So after I hang up the call with you, it is, you are going to go do X, Y, Z. And you're going to do that not today because you don't have a car, but tomorrow. And she's documenting that wonderfully in the chart. So now just kind of putting a more structure around that. And with a goal in place, and certain other things, our triage nurses will be billing for those calls.
That's great. I do want to ask you about the resources that you said, of course, in your work with patients, you're educating, you're doing an assessment, right? You're educating, and you mentioned being able to connect them with resources. So what kind of resources are those, and how do you connect them? Is it something that they do? Is it something they read? What are the resources that are key for you?
So that's just a really fun part of my work is, again, just really having that relationship with a patient, and then, kind of asking at some point along the way, how do you learn best? Are you a reader? Are you a podcast listener? Do you like to watch movies? How do you learn best? How do you gather your information? And then honing in on exactly what, not overwhelming them with too many resources at once. But within Epic, we have the ability to build smart phrases. And we've come together as a team and developed a whole list of smart phrases, some of them broad and general, some of them very specific. We have a one pager that has our favorite books, movies, podcasts, groups, local groups to join to help them feel supported in their journey with lifestyle changes. So, but many broad and specific, lots from the ACLM, of course, the ACLM plate, the salads, how to make a salad, salad dressings, sleep, stress management. We use lots of those handouts as well that are all part of our smart phrases. So with that, through the patient portal, I can send them that way. A lot of times, if they're of the right age group, I might print and mail the good old fashioned way. So, and at our group meetings too, I always bring our collective books, my own book collection, and providers and other different sources of information. One of them being our local hospital, Trinity Hospital, St. Joe's in Ann Arbor. All of the RDs, nutritionists there, are plant-based. Imagine that. And they have started this entire calendar year free to any patient within the Trinity Health System. You can join once a month on a Tuesday and watch a live presentation of cooking with plants. And if you join for free and you miss it, you get the recording of it the next day. And the patients are finding that just wonderful. So anyway, just that's an example of some of the education. I'd have the handout with the UR code to scan to go to those. So lots of different ways to get information.
Right. And I don't know, I haven't used Epic in a while. Like I said, it's been a few years. But when I did use Epic, I was a master at finding other people's smart phrases. So if you were to find one across the entire Epic enterprise, you could ask that person to share it with you, make you a user, or you could also borrow it. So there's, I don't know if you guys are encouraging other providers to also use this information, because somebody who's not in the lifestyle medicine clinic could probably benefit from using some of that great info, I would think, to share resources.
Absolutely. We should probably be a little better about that, to be fair, but we are kind of getting the word out there, and other providers, specifically our specialty groups, have kind of turned on to lifestyle medicine. And they're hearing about us in various different ways, but getting them kind of that information, a lot of times we'll send them different bits of information and kind of continue. That's part of our growth. I mean, we're really just kind of moving this group forward in many different ways. And yes, that is one of the areas we need to really hone in on, getting that information out there.
Right. And interestingly, Deborah and I, who's my collaborator in this project, just had an interview with Josie Bidwell from Mississippi. And she's been able to partner with those specialty groups like ortho and GI to say, what is your need? How can we, as a lifestyle group, help you fill the gap there? And that has been really great for their practice. So that may be a way to collaborate with them too.
Yeah, we actually have, and I should mention this because we have two websites or two resources that one is public facing and one is internal. On the public facing website that I send to a lot of patients via my chart is the ACLM short form, our Wednesday wellness lecture series, which is our lifestyle medicine providers talking on certain Wednesdays about a different topic related to lifestyle medicine. We also have the link to the Forks Over Knives movie and more on the public facing website. And all providers, although maybe raising their awareness of this would be a great idea, but we have an internally facing website. And with that, we have an algorithm based on the trans-theoretical change model. So you can click on any of the change patterns and get a little bit of information downloaded right away from those. We have our special interest group lecture series on the internally facing, as well as our quadruple aim lectures and some cooking demos. So that's available for our providers and other staff. But again, raising the awareness and keeping the awareness there is key, right?
Mm-hmm.
Mhm.
Right. So, what do you think some of the key barriers are, or challenges or obstacles that you have come across in terms of the wider adoption of lifestyle medicine principles, just within healthcare settings, maybe primary care specifically, but you could comment on any of it that you know about?
Yeah, so just lifestyle medicine pillars in general, lack of understanding, so many barriers, and I think the probably the biggest one is all of the conflicting information out there today, and just a lack of awareness of really what lifestyle medicine is all about, and the science behind the whole food plant-based diet is so commonplace for we healthcare providers in the field, but still there are providers that just really don't have that much awareness or education on that topic. So I would say that's the biggest barrier, a lack of awareness and conflicting information about different types of diets would be a challenge, yeah, for related to other healthcare providers.
Right. And I feel like we hear some of the same challenges and more people we talk to, lack of awareness being a big one. So I think there's a free 5.5 hour lifestyle medicine CME that people can sign up for. So that would be great if people want to raise their awareness. I also work in a regular primary care, and the providers are busy. It's hard to be able to take the time to learn all this extra information, but it is evidence based. It's very solid evidence. So,
It is. It is. So one of the things we do as our partnership with Rochester Lifestyle Medicine, each month we pick our marketing department picks a different office, whether it's primary care or specialty care, and with provider permission from that office, they get a notice that all of your patient panel is going to get this invitation to join the Jumpstart program to better their health, to reverse chronic illness, and better their health. And if they have any contention with that, they can say, not my panel, please. So otherwise we flood those patients with the invite to go to the Jumpstart program. Then when we get a few takers, once they're completed, we have a wonderful partnership, and that provider specifically will get a fax saying, look, your patient just completed the Jumpstart program, and look at his numbers, look at her numbers, look at how things have improved for this patient. So hopefully triggering a little bit of interest and curiosity about what that is and why that happens. So that's one of the ways we kind of encourage more information.
absolutely. Two things you said there. One is, the evidence base. So I want to know, how do you personally stay up to date with the evidence? And then any particular patient story that you could share that is really an example of what can be done with this lifestyle medicine first approach?
Sure. So how do I stay up to date? I'm more of a podcast listener and I have my favorites. And so I just continue I love listening and reading, and I'm rereading Atomic Habits right now, and getting a little bit more into that. But yeah, just the concepts of lifestyle medicine and the latest and greatest research. And my favorite site is nutritionfacts.org with Dr. Michael Greger. I get his daily videos. Yeah. And just, and then can investigate further, but just all that, yeah, that just continuing to explore and be curious and keep your mind fresh. So patient success story, is that you wanted to know a patient success story? I love my most current patient success story. I have had many. I had a favorite before this, but now that's been trumped. So this currently, I have a wonderful young mom who's 40, and she has 3 kids, one child in elementary still, and a middle school and a high school. She came to our group with moderate to severe RA. She's on Humira injections weekly, methotrexate, and more. And her biggest complaint was, I'm just so tired and sick. And I'm so tired of not having the strength and the energy to really engage with my kids. I just feel poorly all the time. So really working with her, she joined our support group, our group visit. She's learning lots there. She went through the Jumpstart program, which is a 15-day indoctrination kind of into the whole food plant-based living. And the greatest success is I have to actually prepare myself before I call her, because I honestly get teary when I talk to her because she is so excited. One of her biggest complaints when I talked to her just one-on-one was that the neighborhood moms would walk a mile at the end of every day to pick up the kids at the elementary. The elementary school is right there. And she couldn't do that. That was way too much. And she is now feeling so much better that she is doing that walk. Not only is she walking the mile with the neighborhood moms, but in the evening, she and her husband like to walk a couple more miles. And she could not be more excited about that. Her energy level has improved immensely. Her overall inflammatory markers have improved immensely. She told me, used to count down the days till Sunday when she could do her Humira injection. And she would say, oh gosh, Nan, on Friday, I'd say, okay, just 48 hours more. I can do it, because she was in such pain. And twice now she's told me, I forgot to do my Humira injection. I forgot. So talk about a success story. I know she is just wonderful. She is just couldn't be more excited. So that's my current favorite story.
I love it. I love it. I think it's amazing. And I don't think that people know. And, one of the things that brings up a good point is that I feel like there are some conditions that are very well researched and evidence-based, and there are others where we're gaining more and more. And the autoimmune kind of conditions, I think we're gaining more and more information about those and how a plant-based diet and lifestyle medicine can impact profoundly those people with those kinds of conditions. Yeah. It's really so powerful because people with those kinds of conditions actually feel really bad. I mean, hypertension is called the silent killer because you might not feel that bad, right? But when you can have that such a profound shift in the way you feel and your outlook on life, it's really powerful. So thank you for sharing that. That's an amazing story. So getting to that, you talked about her inflammatory markers. Do you chart or track outcomes of any kind of objective data or even qualitative data with your patients?
We do. So as I've said before, we're lucky enough to have a program manager for our organization, for our group, our small and intimate little group here. So we do track different things. So currently we track 3 main areas. So the first is, as part of for our staff, we have what we call the Stay Well program. And so that's not patient forward, but for our staff, they can listen to our Stay Well lectures. They can participate every month. We have a different challenge, whether it be diet or exercise or mindfulness. And with that, we survey them. So we have, we track that. And overall, we're tracking, one of the many things we're tracking with our own internal staff is the feeling that they have better health knowledge and that they have made a change in their health behavior in one way or another, and satisfaction with that. So that's internally. With our patients, we track disease reversal in two different ways currently. So if they've been with our program 6 months or more, we track both hypertension and diabetes with A1C. So, and we have the HEDIS metrics and what we're striving for. Interestingly enough, our patients that we are tracking absolutely meet our metrics and exceed them if they've had 2 or more visits with the lifestyle medicine group. When they've only had 1 visit, we have a little bit lower statistics in regards to our hypertension control. With our diabetic group, following the HEDIS guidelines, they've been involved in our program for 6 months or more. We are meeting and exceeding the guidelines for that. The third way we track is with patient satisfaction with the program, and then specifically with the nurse, the lifestyle medicine nurse care manager. And both of those, we are meeting what we have set as a percentile for satisfaction. With my satisfaction, I think I'm up to about a 93% satisfied with the nursing role. So that's nice. So
That's amazing. So, and one of the things you talked about with the Stay Well program about educating, healthcare people, people in the healthcare system, one of the calls to action for the future of nursing is nursing self-care. And we can be a group that really can neglect our care. And so bringing this to the forefront, I think that program would help nurses among, many others, probably, it sounds like. So those are great. Those are, HEDIS metrics. I think, if you're in a small little primary care that's independently owned, maybe your attention isn't as much on that, but especially in health systems, when I've worked in big health systems, there is a lot of attention on those metrics, which are important. But the qualitative ones, I think, like the mom that you talked about, having more energy and just more, it sounds like joy in her life, those are also incredibly important, things to look at,
yeah, absolutely.
So that's my opinion.
Absolutely. Yeah.
So
And when working with patients, that's what you really have to focus on is how do you feel? How does this make you feel? And, really in there, getting really into that personal relationship, I frequently start my calls with, tell me something that you're really doing well right now. And then go into, tell me something that you're really struggling with this month, and really kind of, going at it from that angle. So.
right. Yeah, I love that. And that really just engages them to have a meaningful conversation with you. What would you say, any advice that you would want to give an RN out there who's just discovering lifestyle medicine or hearing this for the first time, or even those that are, well into it, that maybe even struggling? What kind of things or advice would you give them?
Oh my goodness. Dive in, stay the course, dive in, learn more, join the nursing MIG, be with like-minded people and just continue to learn more about it. And don't be afraid to spread the word and share the wealth. And we're now a whole community and can support each other, and we have resources to share. And yeah.
Mm-hmm. And so what you were talking about, that was the American College of Lifestyle Medicine, RN, APRN member interest group, I believe is what she was talking about when she said MIG. With our project here that Deborah and I are doing, it's going to be in preparation for our concurrent presentation for the ACLM conference in, the fall of 2023. But we're hoping to be able to create a library that people can go back to and look at. So with this project, bringing this information together and kind of synthesizing it specifically for nurses, like if you had a magic wand, what would you see come out of this project?
I love what's already being done. And I really love the idea of sharing our resources. And one thing that I've already needed and used both from Kelly and Deborah is the PowerPoint of their presentations. I've had the opportunity to present a couple of different times to the nurses within IHA and then the nurses, the care managers within the state of Michigan. And that was so beneficial and so helpful to not recreate the wheel and just have that and be able to kind of pick and choose. So I think we have a great opportunity to connect and share. And I think we're well on that road. So I think continuing that and not being afraid to reach out and ask for help and get connected to someone in your state or in your area and collaborate. So
Yes, I love that. Thank you for stating it that way. That's a really great thing, because sometimes in my own experience, I don't know, yours may be different because you're in a lifestyle medicine group, but mine has been that, I come together with all the ACLM, I get really charged up, a lot of like-minded people, and then when you go out into practice, you might feel like you're kind of on an island by yourself. So having that support of the other, clinicians and healthcare professionals is super important, and it's just reinvigorating. And when we can share resources, it's pretty amazing that way. So saves us all a lot of time. We can get further faster when we all work together. So
right, exactly.
yes.
Yeah.
Yeah. Well, Nan, thank you so much for this. I know we've taken up a chunk of your time today, but your wisdom is so important. And, you're really showing other RNs what can be done in this field and how you can make a true difference, because sometimes we feel like we're not really making a difference. But once I found lifestyle medicine, a lot of other people say the same thing. You really, truly see what you can do for people. And it's just, that's why we got into this profession, right? In the first place.
Such a great, this is such a wonderful role. I am so honored to be part of all of this. And yeah,
Mm-hmm.
feel so fulfilled as a nurse. So reach
Yes.
out anytime.
Yes. Thank you so much.